Thank you, David and Vivian, for setting us up for this last part of the presentation. So what Vivian mentioned was overall framework and understanding around uptake of intervention in improving programs and policies. And David Test's presentation talked about how their center is providing support for improving dissemination of evidence-based practices. And what I'm going to be talking about is how we are taking the lessons learned from the works of David's Center, as well as with the William T. Grant Foundation, as well as our own experience in New York State in building and setting us up for implementation of a project that we got funded last year called the New York State Promise Program. And Promise stands for Promoting Readiness of Minors in Supplemental Security Income. And this project aims at improving transition to adulthood outcomes for youth with disabilities who are receiving SSI benefits. And the structure of the program is to be able to recruit 2,000 students in the state of New York across 3 different regions. 1,000 of them will be randomly allocated to the Promise group, and another 1,000 will be allocated to Services as Usual group, and that's the approach. And based on, again, our understanding of how do we implement or design interventions, we wanted to design interventions that utilizes indigenous model that naturally equips the existing supports and structures. So these are different partners in the project, which include schools, local disability service providers, literacy zones, regional parent training centers, work incentive planners, regional transition specialists, and other community stakeholders with an intention to achieve higher post-secondary outcomes, which includes improved employment, education, and economic outcomes for SSI youth. And we do this with the intervention that we are proposing currently includes 3 major parts. So there are 2 bars on the end of the slides, and they are kind of the holding bars for the entire intervention. And in the middle, there are 3 boxes at the top. The first box is services under outcomes-based payment model, Promise-sponsored case management services, Promise-sponsored parent training, information, and family coaching. So these are kind of the big 3 major services that are offered under the Promise project in New York State. And the hope is that services under outcomes-based payment model improves the quality of the services that are provided for students in the Promise program. And improved case management helps in improving collaboration between the local education agencies and service providers. Improving parent training and information coaching helps improve self-determination and expectations, engagement, attitudes towards work, and financial literacy. One thing I do want to point out, as our project officer did this morning in the meeting, is that one of the hallmarks of the Promise project is there is a specific emphasis on families and parents who are in need of services to help improve their overall economic outcomes. More or less, these families come from low socioeconomic background for them to become qualified for SSI benefits. So there is an explicit family component that is a part of the Promise project. And we do have increased access to state and national TA on best practices, and David Test Center is one of our partners in the project. But the overall project implementation, as well as the specifics of design, are also informed through a continuous quality improvement process and the feedback loops that we've established within our system. So the framework that we've adopted in continuous quality improvement, which is going to help shape some of our intervention strategies, include a 3-part process. And this was described by Uran several years ago, where it includes three steps. One is quality planning. The second one is quality control. Third part is quality improvement. And in terms of the Promise project, what we are doing is, in terms of quality planning and processes, again, this is all specific to the Promise project, and what I'm doing is to be able to use this in illustrating how we are working towards increased adoption of interventions that are evidence-based. So first thing we did is we have an outreach and recruitment guide, again, based on all the leading evidence-based practices. So there is a step-by-step description of how to implement that in the field level for different practitioners who are engaged in the implementation. There is a Promise recruitment tracking system that is designed to continually track the recruitment and targets on a quarterly basis so that each and every stakeholder who is a part of the Promise project and is responsible for recruiting the students in our project will have access to the data on a real-time basis so that they can adjust their strategies as they go and implement the project. The intervention guide for practitioners and evaluators is an important resource because it lays out intervention by describing what are the organizational characteristics that an intervention of this nature should have. What kind of staffing is necessary for implementing specific types of intervention? What are the activities that will be part of that intervention? What are the outputs? What are the quality indicators? And what are the outcomes? All of this is described in the context of the intervention guide so that the engaged stakeholders and practitioners have a benchmark that they can look forward to ensuring that the full and accurate implementation of intervention is achieved. At the same time, it helps guide our evaluation approach so that helps us to have the benchmarking tools necessary for us to be able to measure the extent to which intervention was implemented, as well as to understand the extent to which the intervention was received by the participants, because both aspects of delivery and the receipt of interventions are measured through that process. We also have training for using project MIS management information systems for different stakeholders as they are conducting data entry, because it's important to capture accurate data to be able to really see the results of the study. Then there is a training available for stakeholders in implementing the outcomes-based payment system. And again, with the lack of time, I'm not getting deeper into what that means, but the notion is that the payments are for different service providers is structured based on specific outcomes that those services are intended to achieve. We also conduct organizational capacity assessment for implementation, so that helps us work with different stakeholders to set up their organizations and work with them to have necessary front-loaded resources to be able to achieve the level of implementation necessary to see the impact of the overall intervention. And more importantly, there is brokering of relationship between project partners. There'll be formation of regional teams of stakeholders that come together and discuss about the project on a periodic basis, understand the achievements, celebrate success, but also fight out on very difficult issues in terms of differences in policies and program barriers. At the state level, we have New York State Promise State Steering Committee and Coordinating Council that helps assist us with getting different agencies in the room to create a space for a dialogue of improving policies and making the program implementation seamless across different agencies. The quality control tools and process. So that was all about planning. So we are planning for all the different systems player, program players. Now the quality control part includes getting a project management information system that helps in tracking program participation and services. There is an online training technical assistance tracking system that helps track all the TA in the project. Then a program fidelity assessment tool, which is a blend of qualitative and quantitative indicators that helps in assessing, again, the dosage of intervention that was delivered, as well as the dosage of intervention that was received from the perspective of the youth and families. Then there are youth and parent voices that will be captured through qualitative interviews as well as the survey. And the stakeholder voices will be also included in shaping some of the interventions, and those will be captured through collaboration survey, biennial learning community, and steering committee meetings. So these are different quality control tools that helps us in assessing quality on a periodic basis through a systematic process of data collection. The last part, which is quality improvement tools and processes, and I think it's probably the most critical part of the project, because this actually ties in to the overall notion as to we are implementing an intervention in an indigenous model in a way where we understand and appreciate the complexities of the system and work with the system so that there is an increased adoption over time for implementation of the project. So there are quarterly automated reports that our management intervention system, management information system, will be developing and will be available to all the stakeholders so that they can engage into a discussion around the outcomes and successes, but also deliberation around what actually was done well, what worked, and what needs to be done. So we bring them together in a biannual learning communities where these stakeholders get together and talk about it. In fact, our project officer joined us for our first one where we saw different stakeholders come together and debate out the overall intervention, but at the same time also talk about the specifics in terms of what they needed to implement. But the later learning committees will involve deliberation on the data, what we are seeing, what are the barriers, and kind of coming to consensus of the next steps of action. What we are also doing, including the stakeholders, is we are utilizing a methodology in the social science field called concept mapping, and that helps us in creating mental models of different concepts of barriers, different concepts of successes in a very visual way. So it's a multidimensional, multivariate modeling technique that helps in organizing different ideas into maps. And we would like to see this mapping process over the period of the time of the project change over time. So we, as a community, come together, talk about this. There's a map that gets created. At each community, we revise the map, revisit that, and see how that changed over time, whether it changes in the direction of the project outcomes as was intended. And of course, there will be annual progress report that will be informing the entire project community. And last but not the least, we do want to talk about our ability to access the national and state TA to help inform on what are the leading evidence-based practices in transition and engage at a larger level even with our peers and colleagues here in this room and in the area of transition and career preparation to learn from them as to what are some of the practices that could be taken back. So in certain ways, it's a broad framework, it's an open model, but a model wherein certain critical principles guide the implementation, but we are also interested in encouraging adoption of new interventions as we go along through the project. But this is all being conducted in the framework of continuous quality improvement with an intention that the implementation of the project achieves its goal and impacts the overall outcomes for youth and young adults with disabilities, especially those who are receiving supplemental security income. So I think that was it.